The Eating Disorders Resource Center is an incredibly valuable organization here in Silicon Valley. And I know from my perspective as someone who treats eating disorders, they've just been able to bring together a lot of us who have been kind of all working alone. And we get to meet each other, and we can actually do more effective treatment that way because we can form teams. So a physician that I might know of but not really talk to very much, I get to know through activities that the EDRC puts on. And we end up being able to work much more effectively as a team with our patients, which is really helpful. I think the community needs to know that the work that the EDRC is doing is incredibly important. It's raising awareness about eating disorders in the community and how serious they are, and how important it is for people to come in and get treatment early, because as soon as you can, that's better. It's more hopeful, and there is great hope in terms of getting better. There's many, many people who have recovered from eating disorders. So I think the EDRC and all of us who treat eating disorders really hope that the community will, support in any way it can. Come and see the activities, give money, call us with your questions, call us with your resources if you know something that's going to be a really helpful thing for the community to get away from eating disorder culture. All that stuff is really important. Eating disorders are an incredibly serious problem. I actually sometimes talk about them as eating disorders separate from the notion of disordered eating, because there are some ways that, the DSM, the diagnostic manual, has certain criteria for you to have an actual eating disorder, but an awful lot more people have distress about their bodies and worries about their eating and concern about all of this that's really upsetting to them and unnecessary. So I actually think of it as a big spectrum of a problem, and it's a terrible problem. I mean, I think when I ask people, think of somebody that who's really happy in their bodies and who's peaceful and who's comfortable with food, it's really hard for them to think of people. And that's so sad to me, because we have these incredible bodies. They're very diverse. They come in all these different sizes and colors. They do these amazing things for us. But when we grow up in this culture, we're taught that they're, about to zoom out of control, and that we have to police them, and we need all these products and services, and it's like, what did people do 100 years ago? Obviously we don't need all of this stuff, but it's really hard to remember that and to trust your body and to be in a kind of partnership with it. Actually, I see the war on obesity as another expression of the hysteria around weight in our culture. The actual numbers, if you look at the numbers, are actually not nearly as alarming as most of the news presents it. The average person is about 10 pounds heavier than they were a generation ago. To me, that's interesting, but it's not particularly alarming. And actually, those rising weights have stopped rising a good 10 years ago with children and in adults. So we're not really in a crisis around this, but we are in a crisis of cultural panic. And that cultural panic is exactly the same panic that drives patients into my office. And I want to make it clear that the culture influences the development of eating disorders in an interaction with genetics. It's not just media, it's not just culture, but if you are vulnerable to developing an eating disorder and you live in this culture, it's the worst possible culture. It's going to trigger that gun, and it's going to make you express the vulnerability that you're potentially carrying for other reasons, The media has been held up as the big problem for many, many years, and it is a problem because it does exist. I mean, what we normally see is not the expressions of our community, or artistic expressions of our community. What we see are corporate messages that are here's what the world is really like, here are the winners over here, and you're a loser if blah, 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 you don't get our product. So we don't really see ourselves accurately because the media is not really about that. It's not a mirror, it's not art, it's not culture. But what it is, you can develop a certain critical way of looking at that and a way of thinking about it that's very, like that's what it is. It's there to sell you stuff. And you can orient yourself to not getting as much of that in your life, and you can orient yourself to what are the cultural, what are the real cultural art, productions that are around you. What are the real things that people are going through in their real lives? You can actually ask those questions and be open to that instead, and you're going to have a completely different experience of who we all are as people. Part of my work as a healthcare provider is to work with other healthcare providers around their attitudes. And I have a very interesting perspective because I work with a lot of really wonderful fat activists, fat acceptance activists, and I also work with a lot of people with eating disorders. And so I actually work with a lot of fat people who are incredibly healthy, exuberant, they're having great lives. And I'm working with a lot of thin people who are really, really tortured. And so it really breaks the link for me between size and health. And so what I've been trying to do is to help create another model called Health at Every Size. And that Health at Every Size model helps us all, including healthcare professionals, stop looking so much at weight and start looking at how we live our lives day to day and really support people doing what gives them a sense of well-being and not worrying so much about what their weight is. Because people come in all different sizes, they come in all different heights, they come in all different weights, and what I'd really like to see is that we treat and prevent disease, not diversity.